tummy pain, maybe some behavior changes. So Fluzat is 12 and up. We use that similar. You gotta start within 48 hours of symptoms starting, but you only have to take 1 dose as opposed to 10 doses. So less side effects, same recovery, maybe a little faster. Some studies show maybe a little faster. More expensive though. So I listed some complications you can get from the flu. Of course, secondary infections, myocarditis, encephalitis, rhabdo, all these horrible things, respiratory failure, sepsis, and of course exacerbation of asthma and diabetes and all that. So, I'm gonna review the flu vaccine dosing. Remember, at 6 months or older, we're doing all 0.5 doses, no more 0.25 doses at all. Fluzone is our 6 months to 18 years, and they're all the pre-filled, no preservatives. So people are gonna ask you, preservatives? No. No mercury or anything like that. Flu Mist is back on the market. You may have some people, especially shot nurses, may get asked about it, but we are not getting any this year. Okay, so let's go over who needs 2 doses. This is not changed this year at all. They still have the same recommendations. So if you're 9 and older, you just get 1 dose, right? If you have had 2 doses in your life and you're under the age of 9, you just get 1 dose. But if you have had 0 doses or 1 dose, then you have to get the 2. Does anybody have questions about that?
If you've had the flu before, the actual influenza,
Yeah.
you only have to have 1 dose, right?
Oh, I'm not aware of that. I usually give the 2. I still give the 2 personally. I don't know the actual recommendation on that.
I haven't heard that either.
Make sure, of course the doses have to be 4 weeks apart, so that's super important. Every year we get somebody who's it's too early to get the other dose. So operators and everybody who's scheduling, just double check and make sure it's at least 4 weeks. Okay, Flu Block is 18 plus. The difference is it's not made with egg products at all. There's no preservatives still. We're doing all the pre-fills. And it has 3 times the amount of the antigen in there, so it actually produces a better response for 18 and older. So maybe up to 40–45% more effective for people 18 plus. So that's why we give that. Remember, pregnant women can get flu vaccine at any point. It's recommended during 3rd trimester, but they can get it anytime. And then egg allergy. Remember, this changed a couple years ago. So even if somebody has an anaphylactic reaction to egg, the allergists are saying they can still get the flu vaccine. So if they ask you, then they can still get it. If they feel more comfortable getting it at the allergist, then that's fine. But the recommendations officially are that they can get it here. And remember, if they're in for a sick visit, just ask the doctor before you pull up the shot. They usually can get it unless they're febrile or have some other thing going on or respiratory issues. They can get it with their other vaccines. As you guys know, we've been giving it a ton of checkups. And remember, you can't get the flu from the flu vaccine. Someone's going to ask you about that every single year. We can give it to any family member that wants to get it, except for those that are over 65 and those that have Medicare as their primary insurance. So if a grandparent asks you, then those are the qualifications.
Can they be over 65 with private insurance?
No, we don't have the product for those over 65.
We don't have the high
Okay,
dose one.
because I put my aunt on the one that called.
Okay. Yeah, we're not getting that high dose. It's a higher dose than the flu
Yeah.
block, so
Yeah.
yeah, we don't get that one. Okay, that's it. Short and simple. Questions?
Guys have any questions for Dr. Tom? So basically, flu shots. We, when you're scheduling parents or scheduling patients, please ask the parents if they're gonna get theirs or any siblings are gonna get theirs that day. It makes it so much easier to schedule them ahead of time than after the fact. A lot of parents are hemming and hawing about, let me talk to you. I don't know. Just, if you can, just put them on the schedule. We can always take them off the schedule. It's easier to err on the side of caution than have since we're trying to keep the lobby as empty as we can, having parents come back up here and having it's not empty. It's not an empty lobby. So as proactive as you can be to schedule them. Dr. Lau, do you want to talk for a minute about what you told us all about the MMR?
Oh, okay.
I've told some of you this, but I want you to
Christy,
hear
make
it.
sure they're not in the, out there in the park.
So,
See anybody, anyone?
there's been a few articles that's come through about, why are children not getting it? And then the speculation is, does the MMR vaccine is specific for measles, mumps, rubella, but does it turn on the immune system in some non-specific way that it might end up having some protective effect against viral illnesses such as coronavirus? So there's been, the articles are pointing to it's a low risk with potentially high reward possibility. So there's a lot of healthcare providers and a lot of are getting an extra measles, mumps, rubella. In fact, my nurses have gotten an extra measles, mumps, rubella. I had an extra one last year when we went through the measles scare and outbreak. I've had a lot of my physician colleague friends who've gone to local pharmacies to get it. There's not any scientific double-blinded randomized studies, because how are you going to do one of those and tell people, oh, you're not going to get the measles vaccine because measles is bad and its attack rate is horrific. So if you guys as employees who are on the front lines, if you want a measles, mumps, rubella vaccine, that is available. If you've had one, Dr. Todd, what were we saying? If
5
you've
years.
had one in the past 5 years, you don't need one.
Yeah.
But if you cannot remember when you've had one, that is an option of what we can end up doing.
So if you guys think you want one, go ahead and get yourself on the, have one, put yourself on the schedule. We'll send it to your insurance company. We haven't had any claims rejected yet for it, so it's not, that shouldn't be an issue for anybody. If it is, holler at me and let me know. But if you want to avail yourself of that, go ahead and do so. We've got a lot
Can you pull
of,
up PCC? Can you pull up PCC?
we've had, you know where he's going, Christy? I want to remind everybody, when you're returning phone calls, look through the chart. If the phone number doesn't work or there's no voicemail or something set up, we've got two options. One is to go and look for another phone number. The other is one that was included in the update. You can go to the, did Dr. Lau do that, or is that somebody else? Okay. I thought we had another visitor. Do you?
I'm gonna show after she
Megan's
gets
gonna
it.
show you guys how to, so phone nurses, if you're trying to get a hold of somebody and their voicemail's not set up or they're not answering, you can use this feature and say, hey, this is HPA, trying to call you, please call us, your voicemail's not set up. Whose voicemail isn't set up? It's crazy.
Or find a different phone number from a siblings chart or a past phone note, or just
Right.
do some a little more digging instead of just saying you can't get a hold of them.
Yeah. But we'll show you how to do that. We're using that feature, as most of you know, for bringing patients into the office. Letting them know when we have a room available. Is it?
We can come back until she gets it,
Yeah.
go through the rest of them, and then I'll go back and show
That's
them.
all that's on my list.
Oh.
Do you have anything else?
That was it?
Let's talk a minute. Dr. Lau, do you also want to talk about, that committee you're on with the
Yeah,
schools and all that?
So I'm also on a local committee of one of the schools about, there's a lot of other people, physicians, and the CEO of Crestview Hospital is on it, and then she was talking about the transmission and how her employees got it. Okay, and people wearing their PPE, wearing their personal protective equipment, wearing your mask, wearing your face shields, and when you're doing the procedures, when people follow those rules, the employees are not getting it. She gave examples of people and employees getting it when they when they inadvertently let their guard down, okay? And so that's examples that I got after a group of you who were sitting out there under the picnic tables. When we say social distance, and you can sit out on the picnic tables, but sit 6 feet away, okay? And because she gave stories of the nurses and the personnel who got it at Crestwood, where when the personnel let the guard down and they happen to sit within 2 feet of each other and they're eating food, which you have to take your mask off, and then that's how they've had spread amongst their employees. They're not having the spread from a contaminated patient who then subsequently had given it to one of the personnel who was doing the appropriate masks, gowns, face masks. And also, we have to lead by example. And so, if we have parents who are driving around and they see us not leading by example, that sends the wrong message. And I know it sucks in this whole time, and coronavirus does suck for all of us. That's what we'd ask of you guys. If you can just we want you to be able to eat outdoors, but just try to space it out if you can, okay? And then we'll end up getting through this, and I'm sure this time next year, we're hoping Dr. Todd will be talking about giving a coronavirus vaccine to everybody. I think it's coming.
Yeah.
So, but is that what you wanted me to point out?
Yes, thank you,
Yeah.
Dr. Lapp. The reason I'm saying that is, we haven't had any patients, tell me if I'm wrong, any patients with really bad cases, right? We've had some positives. We haven't had anybody that's really sick. We haven't had to admit anybody to the hospital, right? Right, okay.
Correct.
The point is, if Terry Curbo, Lindsay, Liz, and Lisa all test positive, they're gonna be out for 14 days. That's 4 doctors that don't have a nurse. So what does that mean? We're gonna have to tell 4 doctors, you can't come in today because we don't have enough nurses, and we're gonna have to cancel those appointments. So it will impact us at some point. And I'm just asking all of you to be careful about that social distancing, wearing your mask, and of course washing your hands. Because even if you get it and it's not bad and you're sitting at home twiddling your thumbs and wanna come back to work, I can't let you back to work. Your coworkers don't want you back to work because they're nervous and scared. So just be aware of that. If we have 6 nurses fall out of the rotation, we're dead in the water, especially this time of year. If I have 6 triage nurses, I have no triage nurses. If I have 4 or 5 operators get sick, I have no operators. I can't do it all. Dr. Lau can't do it all. Megan can't do it all. So just think about those sorts of things, because we still need to see our patients. We need to get them in for their flu shots more this year than ever. And we just don't need to have people out of the office for extended lengths of time. So just think about what you're doing and be safe. That's all I'm asking. Be safe. And take care of each other. Let's go eat lunch.
Hang on, let me show them real
Oh,
quick.
wait a minute.
I don't even know that lunch is here. Can you, do you want me to drive?
It's here, but we can't have.
To show them how to send a text.
Some of you go.
Oh, don't you just send them?
So, yeah, this is from the schedule screen. You can just hit send text. All the nurses should know how to do this. But there is a way to do it from the chart.
Oh, okay. Well, show
So
me that.
whenever you go in the chart,
How to text a patient from the schedule screen.
It's being super slow.
Really?
Because I'm on Edge or something. We already know how to do that.
Yeah, you know how to do it.
yeah.
I don't.
I can't get it to.
To be continued.